everyone. Today we will discuss about diabetes insipidus. So what is the meaning of diabetes insipidus? First of all, I would like to tell you it is not diabetes mellitus, it is diabetes insipidus. Both are different. Okay. So diabetes insipidus, it is a clinical condition or a syndrome that can occur either due to deficiency of antidiuretic hormone or when there is failure of response towards ADH. Okay, so ADH, either if it is deficient, there will not be exhibition of features definitely, and if there is presence of ADH but it fails to respond, then there will be diabetes insipidus as well. So this syndrome, it is characterized by mainly three features. First is polyuria. Poly means more, uria, passage of large volume of urine. So we can say the output of urine is approximately around 10 liters per day, and osmolality, it will be around 100 milliosmol per kg of water. Second feature is polydipsia. Again, poly means more, dipsia means drinking. So there will be drinking of large amount of water. Okay, even if the thirst center is intact, person will keep on drinking more water. Then there can be dehydration in severe cases because of excessive loss of water. Okay, so antidiuresis is deficient, so there will be excessive diuresis. Okay, it can occur where thirst center is not intact. There will be dehydration in severe cases. Okay, now this diabetes insipidus, it is of two types. One is central or neurogenic type of diabetes insipidus. Another one is nephrogenic diabetes insipidus. So what is the difference between these two terms? Central diabetes insipidus, it occurs because of deficiency of antidiuretic hormone. And how does it get deficient? Because of some causes. You can see the causes here. Because of some tumors of hypothalamus or pituitary, when there is damage to some nuclei of hypothalamus from where these are secreted, supraoptic paraventricular nuclei, injury to head, infections, genetic mutations. Now once the condition has occurred, it has to be treated. Okay, it can be treated by giving replacement therapy as ADH, desmopressin or clofiprid. It is a drug that can be given. So what is desmopressin? It is more active than ADH. D, you can see here, small d, capital D, AVP. So full form is 1-D-amino-8-D-arginine vasopressin. Okay, it has more antidiuretic effect and less vasopressor effect as compared to ADH. Okay. Second type is nephrogenic type of diabetes mellitus. In this condition, the levels of ADH, these are normal, but kidneys, they fail to respond. Why the kidneys, they fail to respond? Because there is a defect at the level of receptors. So ADH is still there, it is normal, but we cannot see the effect because it fails to act at the receptor. Deficiency is at the level of receptor, not at the level of ADH. ADH is okay. So the condition can be caused by some genetic factors, like there must be some mutation in the V2. V stands for vasopressin, which is another name of ADH. V2 receptors in the distal tubules of nephron. Now distal tubule, it is the site of action of ADH. So whenever there is genetic mutation at the level of receptor, ADH won't be able to act. Secondly, it can be induced by some drugs also. Okay, you can see the names of the drug: demeclocycline, lithium cisplatin. They cause defect in the receptor for ADH. Now once this nephrogenic diabetes insipidus, it has been occurred, it has to be treated. Okay, for the treatment we can give chlorpropamide. Now the mechanism of action of this drug is it increases the renal response towards ADH, because already ADH is okay, it is normal. We have to increase the response. Okay, so it can be attained by chlorpropamide drug. So we had seen the differences between central and nephrogenic diabetes insipidus. It can be asked as a very important question, differentiate between these two forms. What is the physiological basis of nephrogenic as well as central diabetes insipidus? You can see here how to distinguish central form from nephrogenic form. I'll provide all the answers in a separate session. Now there is another term, syndrome of inappropriate secretion of ADH. So the answer lies in the name itself. You can say it is a syndrome. So clinical condition, inappropriate ADH secretion. Because ADH secretion, it is increased here despite hypoosmolality of blood. So in this case, there is occurrence of hyponatremia. Means sodium level, they will tend to fall down. Osmolality, it will fall down. And why does it fall? Because of inappropriate continuous secretion or action of ADH. ADH will not be secreted normally. There will be inappropriate secretion irrespective of the plasma volume, whether it is high or low. It will be kept on secreting but not in appropriate way. Inappropriate way mein hoga secretion. Okay. So that causes impaired excretion of water, because irrespective of the plasma volume, there is occurrence of inappropriate secretion of ADH that will affect the plasma volume and water excretion. That's why the condition is also labeled as dilution syndrome. The patient tends to hypersecrete ADH also. Okay, so why it is named so? Because ADH secretion is high despite hypoosmolality. That's why the name has been given, syndrome of inappropriate secretion of ADH. Okay, so the person may be facing the features like water retention, edema, okay, because of shifting of water from hypoosmolar plasma to the interstitial fluid. There will be edema. Natriuresis will be occurring because there will be expansion of extracellular fluid. Once it expands, aldosterone secretion will be decreased. So, sodium secretion, it increases in the urine, term is natriuresis. And as sodium will be excreted in the urine, so there will be occurrence of hyponatremia inside the body. Okay, sodium will be excreted out in the urine. So in the plasma there will be hyponatremia. The term is dilutional hyponatremia. It can be asked as a very small question. What do you understand by SIADH, syndrome of inappropriate secretion of ADH?